Welcome to BW Healthcare World's Thursday Thought Leaders with Harbinder Narula. I'm joined today by Miss Alisha Moopen, who is the Managing Director and Group CEO for Aster DM Healthcare, which is Aster DM's GCC business. Alisha takes care of the strategic direction and development of the company, along with spearheading the compassion of the group into new markets. Welcome, Alicia, to BW Healthcare World. Thank you so much for taking our time today.
Thank you. Thank you, Harvinder. Thanks for having me.
It's a pleasure. Alicia, before I get into our conversation around nursing, one of the most recent announcements was that of the demerger of Aster India from the global business. How
Yeah.
has your leadership role evolved, keeping this in mind, and what are the new opportunities and challenges that have been presented with this change in the structure of the business?
No, really good question. And I think you're asking it, after 7, 8 months of the demerger. So while we made a lot of hypotheses, I think what's materialized is even better than what we anticipated, to be honest. So to give you an example, I think our hypothesis was that in today's deglobalized world, there has to be a very focused strategy for different regions. And we took great pride as Aster as a global entity talking about sort of market leadership across GCC, across India. But in a post-COVID, in the last 4, 5 years, we said it is very important that we have a very India-specific strategy because even in India, each market is so nuanced. It's very important for us to customize our strategy with a goal to become a market leader in India as well, having that focus, and specifically on the GCC as well. Saudi is a huge market that has opened up. We have to have a very different strategy for it, different capital allocation plan for it. The digital health plan that we have for GCC also is very different from the India strategy because of the way the market is, the payer model is different, the consumer market is different, the demographics is different. So we really think that having demerged, it helps us really kind of have a much more laser sharp focus on what works for India, different markets we operate in. And in the GCC, each of the countries has a much more laser sharp strategy now. At the end of the day, it's the people that make the difference, and we said that it's very important that you're not diverting people's bandwidth with too many priorities. So with two independent entities, it becomes very clear what people want to do in each of these markets. So that's what we're focusing on now.
And Alicia, what is now your vision? You spoke about strategy that both the markets could be strategically handled differently. What is
Yeah.
your vision for Aster India's future as an independent entity, and how will you leverage its strengths in the Indian healthcare market, which you yourself mentioned that it's a very typical market, the way people access healthcare, who pays for it, and how they perceive the healthcare delivery, how they perceive the doctors in India. It's a little different from what we've seen across the globe.
Yeah. So, Harvinder, for us, right, our India strategy has really evolved over the last 10 years. And we started more with tier two cities. I mean, for example, our main flagship facility is in Kochi, Aster Med City. And then we came to sort of tier one with Bangalore, where we have Aster CMI as another sort of twin flagship for us. So for us, the focus has been about building large 300 to 500 bed facilities, which are multi-speciality, which really focuses on having 4 or 5 key centers of excellence. We believe in multi-speciality care. We want the best for a patient, in an environment where whether it is for a cardiac requirement, whether it's for an oncology, whether it is something as extreme as an organ transplant, how do you get everything under one roof? Where you have the multidisciplinary approach, where ultimate quaternary care can be delivered by the best of doctors, best of technology, complemented by the best of service. So for us in India, the focus has been more on quaternary care, deep clinical expertise, complemented by high service levels, right? So it is really kind of putting together the most complex and the best clinical care teams together to say that if you have a requirement for a referral, how is it that Aster becomes that place that you go to? So that's really been our focus over the last 10 years, building that strength and getting the best clinical talent really on board for the same. And we believe that that's kind of our distinguishing factor as well. And what we do well also is really marrying the service element to it. Because at
Mhm.
the end of the day, in the last few years, you're seeing an increasing insurance penetration as well. So people have a choice. Do I want to go to X hospital or Y hospital? So of course, everyone talks about great clinical outcomes. If you're able to marry that with great service, then that's what makes the difference, right? So we want to make sure when people come through, every point of their patient journey is taken, whether it is the bottlenecks with insurance approvals, all the way to sort of the nursing community, your discharge. Everything needs to be standing out. Of course, when it comes to clinical care, that's a given. But how do you make sure all the other things are debottlenecked and you have a very seamless interaction for the patient journey to be something where we talk about it as patient delight. At
Mhm.
the end of the day, nobody wants to go to a hospital. It's everyone's worst nightmare, right? Why do I want to go for a surgery? But how do you actually make it a positive experience at the end of it?
Mhm. And Alicia, how will all this impact Aster India's investment in leadership development and talent acquisition,
Mm.
particularly when you're looking at hiring the medical staff and the support staff like nursing?
Yeah, so actually, this is the biggest factor for success in healthcare, right? We say the talent you attract, and it is scarce talent in healthcare, whether it's on the clinical side as well as on the administrative side. How do you attract the best talent? So for doctors, it's really about and for the clinic and the healthcare administrators as well. For us as Aster, we say it needs to be mission driven. It needs to be purpose driven. So how do you attract the doctors who have the same moral compass, who have the same values, who are thinking about healthcare not as a business, but more as a mission to serve. And we believe that's actually helped us attract some incredible talent, and which is why we are able to kind of grow from strength to strength. To the point you're making, on the support staff, we also place a lot of emphasis for the nursing community. How is it that we can help them build up on the leadership pipeline? We believe that nurses are also very well placed to sort of grow in the healthcare ecosystem. They have a very good understanding, both from a technical and from a soft skills perspective, on how to manage the sentiments, the emotions, and the business side of things as well. So we do make sure that within different cohorts of healthcare, whether it's a physician community, whether it's the nursing, whether it's the administrator, we create very robust pipelines for our succession planning. Because that's very helpful for us as we're scaling the business as well. How do we build up internal leaders, right?
Mhm.
So we believe that healthcare needs to be led by doctors, led by nurses. It needs to be led by the healthcare professionals because it needs to be people who understand the soul of what we're doing healthcare for.
And Alisha, India's nursing sector focuses both, faces both significant demand, which has also now become a very big challenge. Now, how
Yeah.
does Aster India plan to address this nursing shortage and also the challenge around alleviating the profession and the status of this profession itself?
So, so I think this is something everyone in healthcare is grappling with, right? Both in India as well as outside. In India, we've almost become the healthcare supplier to the world, whether it's in doctors, whether it's nurses. Now, what's happened is a little bit of a paradox post COVID because not only has the requirement increased of how much nurses, I think it became much more starker in terms of the short supply of nurses in healthcare in general. But when you kind of combine that with the number of people who left healthcare and especially nursing community, that we've had a massive exodus across the world where different people who were nurses said this is too intense with the burnout of COVID, with the pandemic aftermath, people left. So that actually really created a huge crunch in terms of who's available in the nursing workforce, right? So I think one of the things most healthcare providers, public and private sector, is dealing with is this attrition. And it's a major workforce, it's a large workforce. So to be able to hire, rehire is a big challenge. So um, essentially at Aster, even when we instituted this Aster Global Guardians Nursing Awards, the whole idea was how do you sort of at a global level shine the spotlight on nurses, on the amazing work that the nurses do, so that you're able to kind of inspire more people to kind of take up the profession, right? We always speak about nurses as the unsung heroes of healthcare. We always speak about the great work that they do, but they're always sort of in the background. So the whole idea about the Aster Global Guardians Nursing Award is, let us make sure people know about it. We need to have much more dialogue around it, so that it has to be a much more long-term, active, dedicated efforts. That nursing is a very noble profession. Nursing has they build communities, they heal people in healthcare, they take care of the doctors, they take care of the patients. So if we are able to kind of shift that narrative and make it much stronger, it becomes much easier for us to see how more people will come into the supply chain as well. Apart from that, definitely within Aster, we make sure that we have very clear career goal roadmaps. If you want to grow within nursing, what could your life look like? What could your profession look like in the next few years? Do you want to go more technical, or do you want to pivot more to the admin side? Giving these options, giving these choices, so that the nurses can have this variety of options to choose from, and having those dialogues and having those interactions with HR and the workforce. Because the last thing you want, and our chairman always talks about it, I don't want a nurse who started as a nurse to retire as a nurse in the same department 20 years, 30 years later. And there's so many ways for them to kind of make their careers in different paths. How do you show them that path? At the end, they will have to take those choices, what works for them, but we should at least curate it and be able to give them those options within our network.
Alicia, this is very interesting. So specifically, I mean, what is Aster doing towards one training of these nurses so that you can, enhance? It's a need of the business as well. Now,
Yeah.
the second issue is around how the nurses are being treated. It's not just the institution, it is the profession of the doctors, how these doctors treat the nurses. Now, this is more of a cultural issue in any organization. How are you addressing this?
Yeah, no, very good point. I think, see, in Asta, we have values. We have 7 values that we talk about. And out of that, respect is one of the main ones, right? Um, and we say that it's very important that there is no hierarchy in healthcare. Maybe traditionally and culturally, like you said, that is the case, right? People talk about different levels, doctors being very different from the administrators to the nurses. We believe that that should not be the case. We believe that nurses need to be given the same level of respect as other healthcare providers that are there in healthcare. So we place a lot of emphasis on this. At the end of the day, it's the environment you're able to create. Healthcare is a very emotionally charged place to be in. So when people are choosing a profession like this, it is because they really care about giving back to the community. So it's the onus is on the healthcare provider and the employer to make sure that they're giving that due place and due respect in society, right? So those are very cultural. Like you said, it is very important that you are making it very clear what's acceptable, what is not acceptable, the safety of the nurses, the way they're treated, the way they're looked after, the way they're handled. That is very soft nature in an organization, and you have to place a lot of emphasis on how you manage that, right? When there is a disconnect, or when there is and there will be instances, like I said, because healthcare is emotionally charged, people do end up sometimes raising voices, losing temper, whether it's the patient, whether it is other the people in the system, right? So going back and having those dialogues and making it very clear that this is non-negotiable. We treat our nurses with this level of respect, and this is not acceptable, whether it's from a patient or whether it's from anyone else in healthcare. I think those are things which go much deeper. You can all of course talk about pay parity. You can of course talk about retention policies with salaries and things like that. But I think what really makes that bigger difference is how do you know that you're treated well, right? And actually at Aster, our tagline itself is "We'll treat you well," and we say that if you're making a bold statement and you're making a bold promise, "We'll treat you well," it's not about only treating the patient well. For us to be able to treat the patient well, everyone else needs to follow the same mantra. We can't mistreat our nurses and expect them to treat our patients well. We can't mistreat your doctors and expect them to treat the patients well. It needs to flow through right across the entire ecosystem where every person holds that same philosophy and is able to deliver that same promise. Because it's a big statement, and we do abide by that, saying we will treat you well, and that starts with our employees and it has to extend to our patients, and there is no compromise on that.
Absolutely. It is the underlying value
Yeah.
of the organization. And Alisha, in healthcare, when we have conversations, there's a lot of conversation that happens around the public-private partnership, but it
Mm.
is more centered around healthcare delivery, the institution part of it. But nursing seems to be ignored when we are having these kind of conversations. Is there an opportunity for public-private partnership when it comes to nursing in strengthening India's nursing workforce? What are your thoughts on this?
I think, see, these collaborations on public private partnerships, no doubt they will help, well, regardless of which cohort you're talking about, right? Um, I think there needs to be a lot more conversations on how you can make them effective. Everyone, as I said right at the beginning, is grappling with the acute issue. Everyone is thinking today, oh, I've lost, my attrition is 20%, it's 30%. How do I kind of make sure that I have enough workforce to manage the work, right? So some of the interesting things we have tried to do with the government as well, um, Harbinder, is there are a lot of non-nursing work done by nurses, a lot of non-clinical work, a lot of admin work, right? And how do you figure out automation to help support it? How do you figure out that healthcare assistants, right? You could have people who have not gone through the whole nursing career, but healthcare assistants who can do a lot of things like the bedside work, whether it's changing clothes for a patient, wound management, like, minor things, bandage changes and stuff. These can be done by healthcare workers. So if you are able to create, and if we are able to create a good partnership with the public sector, you will be able to kind of come with a mechanism to say, let these be non-nursing work. It's non-core for nursing. Let HCAs take care of, so healthcare providers take care of some of these non-clinical work, non-nursing work. Let us think about automating these things. What are the things that nurses do that takes up a lot of their time? Documentation, which should not be nursing work, right? Nurses are a scarce resource, and we need to be very mindful about where they're spending their time. And if you end up using 30-40% of their time for admin work, it's a waste of resource, right? So I think the PPS in a much more collaborative manner, because that's what's going to help us solve the bigger issues of healthcare both in India as well as across the world.
Awesome. And, I know that Aster DM does these awards every year.
Mm,
And beyond recognition,
mm.
how does Aster aim to translate the learnings from their journeys and best practices and showcase them and turn them into something which is tangible improvements in the nursing care?
Yeah, so we've had like 78,000 applications this year. And, it's come through a very rigorous process of vetting by the grand jury with public votes, right? So when you look at different countries, you've got applications right from India to Philippines to the US to, Papua Guinea to UK to Singapore. And you start seeing that there are so many similarities and there's so many differences in the way certain departments are managed, certain diseases are, the way the nursing leaders, like the ones that we have in our shortlist, have really kind of shifted uh, outcomes, shifted practices, improved outcomes, and where they've reached kind of like the pinnacle of nursing leadership, right? So your point is great, where you talk about how do you share this information. So what we have tried to do is shine a spotlight on these finalists, saying that what are these amazing things people have done in different part of the world, right? Where there's very scarce resources in somewhere like Papua New Guinea to all the way to, very advanced healthcare in US, what people are doing. Now, what we want to do is create these ambassadors across the world where they are able to then go about becoming those voices of change, right? They become the change makers where they are saying that, hey, this is the reason why I have been shortlisted. This is what I've done, which has helped kind of transform healthcare in my country. And you have to use them to be able to create this information, create this, build that knowledge base and be able to explore this knowledge sharing. We have kind of created forums between these finalists to ensure that they're able to kind of share this information between each other. But what we have seen in the past, this is the third edition of nursing awards that we're doing. What we've seen in the past is even the winners and the shortlist from the first and the second, they've gone ahead and become, leaders in their own right, where they're sort of talking about the good work that they've done. And that's really what we're trying to do, right? There's incredible change happening through the nursing force. They are a force of good. They are the force that's going to transform healthcare. Let us make more and more people vocal about the work that they're doing so that we're able to kind of share these best practices across the world.
Alisha, there is one challenge that I have identified when I'm speaking to people, specifically
Mhm.
around sing, is
Yeah.
that there are not many people looking at building a career in nursing, and it's difficult to find good people to take on
Mm.
to this profession.
Mm.
What would be your message, uh, to these aspiring nurses in India and globally, particularly in the light of the awards and Aster India's commitment to this profession? What is it that you would like to say to them?
So this is a very philosophical question, Harbin, if you ask me, right? Nursing and being in healthcare in general is not everyone's profession. You need to have a deep, profound desire to serve community. It is not an easy profession, but it is extremely gratifying and extremely fulfilling. So I think it's very important that people, and it's very difficult when you're a child and you're making these career choices. If there is a lot of narrative around how difficult a nurse's job is, a doctor's job is, how much burnout it causes, how much fatigue it causes, how are you going to inspire the young students and the young generation to pick this up as a profession? They never will. So, whilst that is the truth, and nobody is denying that, there is also the truth in how fulfilling and how gratifying it is to be in healthcare. What you're doing, touching people's lives, saving people's lives, healing people's lives. So let us go back and shine the spotlight on all those positives that will really inspire us to be able to motivate and inspire more and more of the younger generation to say that this is what I want to do. It cannot be the person who says I want to make the most money, right? It is about going back to your gut, saying that I want to do something good for society. I want to do something to serve mankind, and there are few career options that will shine bright. And we believe that nursing and being doctors are one of the top in that hierarchy.
Alicia, I have one more question for you, and this is something which is very close to my heart right now. And I'm working very tirelessly towards this particular thing is the lack of faith and trust in the healthcare system. And
Mm.
I think there's a responsibility in among the hospital owners and leaders to work towards this while they are promoting and creating a perception of the institution as well as the perception around the doctors. What, in your opinion, is the right way to go around this so that people trust the system when they come and seek help? Because, as you said, nobody comes to a hospital willingly, it is their
Yeah,
need, right?
yeah.
So, what is it that we can do?
I think it's all about transparency, right? Sometimes people feel like you go to a hospital, you have to go for a procedure or a surgery, and you don't have enough information about what that would cost. And are people doing what is needed? Are they doing anything more? All these things are going through the back of the mind. So I think the most important thing is when people are coming to healthcare, they're trusting their lives with you. and it is very important for all of us in healthcare to be very transparent, right? They will always be the unknown. Sometimes you're going through a procedure, there are things you have to do because of what you see there, right? But how open you can be about it, how to remove the opaqueness, because the good thing in the last few years is there's a lot of information out there. People can do a lot of research for a large amount. You know what your range of time that you have to be admitted, the cost of a procedure. You largely have a reference range. But even then, the more you do in terms of sharing that information, having those counseling sessions, making it very clear what you're going in for, I think that is needed. Just saying, I'm a doctor, I'm a healthcare provider, I know what needs to be done, and not having that conversation, I think that's where the lack of trust comes in. It's very important that you're having it. You need to make sure that your patient who is trusting your life or their loved ones' lives with you, you give them that time to make sure they understand everything that is involved as much as you can, right? I think we need to give more priority to that. As by default, maybe in the system they're so used to just thinking about the outcome, which is so important, but it is also very important that you're doing the counseling part of it. So
Absolutely. Couldn't agree more with you that transparency is going to lead to predictability, and anything that is
yes,
predictable is more comfortable for any.
you're managing expectations, right?
Absolutely, absolutely. I couldn't agree more with you. Coming back to nursing, Alisha, nurses are one of the most important people in the healthcare delivery setup in India. And we are facing a challenge of brain drain and lack of respect for the profession in the way we treat our nurses in some of the large institutions. I think it's time that we recognize these people for the critical role that they play in the healthcare delivery, respect them for the work that they do, and treat them the way we would treat any other corporate employee. I think that's the responsibility of an healthcare delivery institution. And we must also realize that, at the end of the day, a healthcare delivery institution is focused on creating good outcomes, satisfied patients, and who go back happy. And, happiness is not just about the healthcare outcome, but the way they've been treated. And I think happy and joyful nurses can do
Yeah.
the magic because they spend more time with the patient than the doctor. So I must compliment Aster DM for the work that you guys are doing, building that respect for the profession so that more and more people can take this as their calling. And also they do not compromise on the empathy as the underlying emotion when they're dealing with everyone in the hospital, whether it is with a tired doctor or with the struggling patient. So I think,
Yeah.
thank you for the work that you guys are doing.
No, thank you. Thank you so much, Arvinda. What you said is so true. The nurse spends the longest amount of time with the patient, right? Even when you measure it, you realize that it's not with the customer service who's checking you in or registering you. It's really the nurse who you spend the most time with. And similarly, they spend the most time with the doctors as well. So it is very important that we look after this major force. We call them the life force of healthcare, and you give them that due respect and due recognition in society. So we are very happy that that we've been able to kind of institute this award. It's always been our chairman's dream that the nurses need to get that due recognition. And thank you for all the support and kind words.
Well, Isha, for taking our time to speak with us at BW Healthcare World. I really, really appreciate that.
Pleasure. Thank you.